On Instagram, we have some questions for sure from a patient of ours because they mentioned that they're 3 months post-op, and they're asking, should I be using rosemary oil, and if so, how? At this precise moment in time, 3 months post-op, you've gone through the boring part of the whole process where the hair shed and I'm waiting for it to grow back. So at 3 months, this patient should definitely be early stages of new growth, which is exciting. But with the new growth can come the odd negative, so the scalp can dry out a little bit, which can give some flakiness. What we're looking for really is to sort of maintain the moisture in the scalp. Rosemary oil, it's all over TikTok at the minute when it comes to hair loss. There are conflicting reports as to what it does and what it doesn't do, but for sure as a natural remedy it's always beneficial. There is a specific oil that we do recommend online. It has also castor oil, argan oil in it, rosemary oil, coconut oil. It is quite beneficial for this precise moment in time. When to use it? We always recommend using it in the evening. It's good as an overnight hair mask. Now, there's another part to this question which I would also like to answer because this can be quite beneficial to patients who have not had a hair transplant. There are other options for hair loss, and what we want to do is address both the natural remedies and also the prescription medications. The good thing about rosemary oil itself is that it can improve the circulation to the hair follicles, blood circulation, especially when you're giving it a good massage in the evening, which can also help to stimulate old and new hairs and help to soften up what could be a slight coarse new regrowth of transplanted hairs, which can sometimes happen. Rosemary oil along with these other oils can for sure help with that. But there are other benefits for patients who have not had a hair transplant, and a lot of people do not want to take prescription medications or use any other type of treatments which could irritate the scalp. We will lead on to another question which I've got, where somebody's asked about minoxidil. Now minoxidil mainly is topical, but it can irritate the scalp. So again, rosemary oil can be a really good natural alternative to that. Another question that we've had online, which is quite common. A lot of people do find conflicting answers with research. Does the donor area grow back? Now, the donor area is the area around the back and the sides of which we would harvest the grafts to then later in the day implant into the recipient area. Simply moving some plants or a bush from your back garden, from the source, the root, all the way across to replant into your front garden. In that sense, the plants are now not growing in two different locations. So in a hair transplant sense, when we take the graft from the donor area to move to your hairline per se, it no longer grows back here. We use a very small instrument, 0.65 millimeter punch, to harvest the grafts. But it is important to spread the graft extraction across the donor area and not cause any over harvesting. That being said, the hairs in which we do not take will grow back as normal, and following 2 to 3 weeks recovery, generally you don't really notice that we have harvested it. That saying, after 2 weeks recovery, the hairs that we have not extracted from the donor area will continue to grow as normal, and the hairs that we have taken unfortunately will not grow back, but because of the small instrument that we use to harvest and the fact that we have not over harvested, you should not miss them with this one procedure. What will my hair transplant look like after 3 months? The answer to this question varies from person to person, to be honest. It depends on the healing process, how quick a person does heal in general, depending on how strong their hair grafts are. A patient should really start to see the very early stages of regrowth at about 3 months, where the odd hair will be poking its way through the scalp. This generally will grow very slowly and steady. 6 months, normally most of the hairs have broken their way through the scalp, and we're just waiting on the density in the following 6 months.